President Obama's push to overhaul the nation's healthcare system is facing some pretty stiff resistance from the insurance industry. But a recent poll among everyday Americans finds strong support for reform. Now, the Washington Post ABC News poll finds 58% of Americans think some kind of reform is necessary. 39% say it will do more harm than good. Scott Stanzel served as a deputy White House press secretary during the Bush administration. Democratic consultant Kelly Bingel was chief of staff to former Senator Blanche Lincoln, and Kelly was on the Hill when the Clinton administration tried and failed to revamp health care back in 1993. Is this the same old, Kelly, or is this a new deal?
This is a completely different situation, John. In 1993, the president, many said in secret, worked with his own staff to draft a bill that they then sent down to the Hill back in September. It took them 9 months, and they sent it to the Hill and said, pass this. This is very different. President Obama has said, I have a goal of reducing costs, improving quality, and improving choice for consumers, and you figure out how to get it done, Washington. So all of the committees of jurisdiction on the Hill have been having numerous hearings. They've done roundtables all around the country. Well, and the idea is that the ideas will come from the members of Congress themselves, and then they'll send this plan to the president.
Well, Scott, you've read the criticism, though, in places like the New York Times Sunday magazine. It said that essentially the president wants Congress to do the heavy lifting so that if something blows up here, he doesn't get the blame.
Well, and I think what you saw last week in the committee hearing in the Senate, where they were actually initially talking about the actual Kennedy legislation, it ran into a buzzsaw. The CBO scored it as adding $1.6 trillion to the deficit at a time when people are very concerned about government spending. And I think some of the interesting things in that poll showed that 8 out of 10 Americans are actually happy with their health care coverage. By a 2-to-1 margin, they think more government involvement will make it worse rather than better. And 60% of the people polled in that survey thought that if government did get involved, then they would have to change their health care whether they liked it or not. And that doesn't bode well for the Obama administration or the Democrats on Capitol Hill that are trying to infuse more government involvement.
Yeah, Kelly, when that Congressional Budget Office number came out of, $1.6 trillion to not even cover everybody, a lot of people said, whoa, let's put the brakes on this thing.
That's right. That was a cost analysis of one of the different alternatives that are floating around on Capitol Hill right now. Keep in mind there are about 4 or 5 different committees of jurisdiction. All of those bills are going to have different cost estimates. The bottom line, though, is that the President and this Democratic Congress are committed to improving quality and choice for Americans. And they are also committed that anyone who is happy with their insurance, which, as Scott said, is many Americans, they will not have to change their health care plans. If you like your health insurance, you don't have to change. But this is focused on folks that don't have coverage.
The challenge, I guess, Kelly, is this. If I were working for a little firm, say 25, 50 employees, and, my boss takes a look at what he's paying out every year for health coverage, all of a sudden he finds out that, oh, Mr. Obama is going to provide, federal health care. I'm not going to pay for it for my employees anymore. Sure, it's one thing to say that employees can keep the health insurance they have, but if the federal government is offering an alternative, what's to say that, that private employers aren't just going to say, okay, go on the federal system?
That's a Republican talking point that we're trying to undermine employer-based
I didn't get that from the Republicans. I'm just asking, I'm asking what I think is a real-world action aspect
it's absolutely not true. I was in a meeting at the White House last week where they said, the people who are happy with their insurance should keep it. We're not trying to undermine employer-based health plans. What we're trying to do is focus on those folks who can't go to the doctor when they're sick. How do we make sure that because the fact is that we're paying for them right now, John. If they go to the emergency room, we're all paying for their health care through higher premiums because we're basically subsidizing the uninsured. So the goal is to get at those folks who don't have health insurance so that you improve the risk pool, increase the risk pool, and consequently lower all our premiums in the long run.
All right.
But that's actually a change.
Go ahead, Scott.
That's actually a change yesterday with President Obama's press conference. He changed his tune on whether or not people would be forced to change their health care plans because he recognizes that those employers will make changes when the government gets involved. And he said the same thing this morning on Good Morning America. So that's a change that's coming, and President Obama has actually recognized that, and that's something that concerns all Americans, those 80% who are happy with their health care coverage. There are ways to get get at the millions who are uninsured, but not do it in a way that spends trillions of dollars from the federal government in a way that manages the care with a big bureaucracy.
All right, we're going to hear plenty from the president tonight, that's for sure. Scott Stanzel, Kelly Bingel, thank you both.